Okay, good morning. So we are now going to be doing ears, nose, throat, mouth. So some of the stuff that we're going to be utilizing you won't have at home. This is a tuning fork. I know you don't all have one of these handy dandy tuning forks at home. Isn't it adorable? So one of the things that you could do is you could just get a fork or a spoon out of your silverware so that you can utilize and practice with it and just have it ready to go. Just something to utilize it with, okay? So this is a tuning fork. You'll notice that it has weights on the top. That is actually very important for doing this exam. When we utilize the tuning fork, you want to make sure that you're holding the base. Your whole hand is not gripping the prongs of the tuning fork. They have names. Don't remember. It's fine. Just remember to grab the base. You're also not going to be hitting this on the bed, on the floor, on your leg, on your knee, on your patient's head is actually the best place for it. But you really want to utilize this part of your hand to then get the vibration that is needed for this exam. Okay, so before you get started, I want you to make sure that you have something to pretend to use as a tuning fork. You also have a tongue depressor, which I know that you all have an immaculate supply of at home, massive supply, but I know you don't. So it's okay. Just, again, use the back of a spoon, something like that, not a sharp spoon.
Toothbrush.
Nothing with pointing. Toothbrushes work great. All of these things can be used to practice with, just to practice having something in your hand, okay? I also have a set of gloves with me and some gauze. You can use a small washcloth. You can use a paper towel. Anything that works for you with that. I had 2 gloves. I'll get another one in a second. Or maybe I'll just use one glove and lick my hands again. I also have ear speculums. These are not vaginal speculums or rectal speculums. They are ear speculums. They look like this.
Thank
they
God.
do come, I know, right? This is going to get us
You
nowhere.
didn't say that was going to be part of the exam.
I'm sorry. Sorry, I didn't tell you. But these are something that they're cheap. They're easy to throw away, so please throw them away with every use. You don't want to go from ear to nose or nose to ear. You do change the speculum. The way that they work is that you have them on your otoscope, which I know that you all have never held before. And when we get back together, we will talk about them. But with the otoscope, then you just put this on and it twists on and locks in place. So it doesn't go anywhere, okay? Because I've licked and played with this one, I'm gonna put it on the side and I'm not gonna use it, okay? So we will go through all of that with you the next time that we have the opportunity to meet, okay? The likelihood of you using an otoscope in your practice really is going and getting it for the healthcare provider that you're gonna be working with. The likelihood of you looking in someone's ear is pretty low, but it's important to understand how to do that, and we will walk you through those steps, okay? I'm gonna again make sure that you see that I'm doing hand hygiene. My same patient is here, and we will pretend again that I've never met her, and we'll go from there, okay? All right, so you ready? Let's go. All right.
Let's go.
Hi, I'm Wendy.
Hi.
I'm your nurse today. I know you want to
Hi.
elbow me
We
today.
do.
Yeah,
We shook
hi.
last time, but that made me uncomfortable.
It did. I'm sorry. Pandemic, whatever.
Elbow.
Yeah, whatever. Anyway, so we're just going to go ahead and I'm going to be doing your nose, throat, mouth exam today.
Great.
And I'm going to ask again what your name is.
My name is Professor Ross.
Okay. And can you tell me where you're located?
I am at Cal State Long Beach in the Sim Lab.
And can you tell me why you're here?
I'm here to do these videos for you students so that you can learn how to do your assessments while we're on lockdown.
And hopefully laugh a little. And then can you tell me who the current vice president is?
Oh, yes, Pence.
Mike Pence.
Mike
Great
Pence.
job. I'm sorry, I fed the answer to her. It's Mike Pence.
Mike
Yes,
Pence.
Mike Pence. Okay. All right, so we don't want to put any of our little things in.
No.
But anyway,
Sorry.
a patient is alert and oriented ×4. No, I did it too. And then
Fine.
I'm
Hi.
not shaking your
Hi,
hand. I'm
how
doing
are you?
cap
It's so good to
refill.
see you.
I'm doing cap refill. Get over it.
So you
Again,
do cap refill everywhere,
I do cap
huh?
refill every single time because I'm all about the ABCs. However, I know that other clinical instructors don't do it. So if you are not in my particular lab, you are safe from knowing cap refill unless it is discussed with your instructor. Okay? But I
Not
check
a bad
cap
idea.
refill all the
I
time.
like it.
Okay, you like it?
I do.
Awesome.
I like it.
You're in trouble. I'm sorry. Okay. So I just check cap refill. It's a habit. I do it when I see any patient, and a cap refill is less than 3 seconds, equally bilaterally on the upper extremities. So I'm going to just do your ear first.
Okay.
So when you want to look at the ear, you want to inspect the ear. You want to look at all of the structures, the names, and I'm going to
All the structures.
the structures. You're going to make sure that everything, the tinea, everything, no
Tinea.
pain, tinea, whatever she said it was. And the 2 piercings, no problems with infection, anything like that related to that. You're also going to press down on the tragus, any pain with the
Nope.
tragus. Great.
Nope.
You're going to repeat that on the other side. You're also going to do this. She does have a scar here. It's a keloid, but any pain, tenderness, she does have 3
Nope.
piercings with 2 earrings in. Any pain, tenderness with that.
Nope.
And then again, the tragus, any pain when I press down on that.
I was actually born with that.
Oh, you were?
Yeah.
Oh, wow. Okay.
Yeah.
What did
I
you
know,
do
and it's
in
different
utero?
than the other side. And you know what? I found that out when I was here as a nursing student in my physical assessment class. My partner found that. And it's like, ooh, your ear's different from this side to that side. Who knew?
That is very weird.
And you just found it again 30
I
years
found it
later.
again. I
Crazy.
know.
Crazy. Full circle.
Yeah.
Everything
you
is
know.
full circle.
Everything is full circle.
Yeah.
So now I'm going to do the otoscope exam. When you grab the otoscope, you want to make sure if it's attached to the cord that you actually wrap around the cord. We have also cleaned this cord, but you want to wrap the cord around your body. The reason is if I brought it in front of my body, I would then be scraping it across my patient. We want to make sure that it is wrapped around the back of our body so that when we're doing the exam, we are protecting the patient from being scraped by this. If you have one that is just a handle that you can take places, that's very different. But if it's attached to the wall, I encourage that you wrap this. You want to grab a new speculum. Again, you screw them on. The light is fully functional, and you can see the light in my hand. When you're doing adults, you want to place your hand right above their ear. You want to lift up and then back to straighten out their ear canal. Now, with pediatrics, you'll learn something different, and that is just for peds. But for adults, hint, hint, test question, repeating it, you want to lift up and back. You're going to feel my hand. I'm just going to enter your ear, okay? You want to place this right at the opening of the ear and then come forward, and then you're going to look. You want to look for the cone of light. I'm looking in her left ear. The cone of light on her left ear is on the left-hand side. You're going to look for the umba and the manubrium. You want to make sure that you look at that on a photograph, and we'll try to find a good one for you and post it. But the umba and that, the cone of light again is at 7 o'clock. The cone of light is actually a reflection of the otoscope. It is not anything exciting going on in the ear. It is a reflection. You want the tympanic membrane to be pearly gray in color, okay? Yours is actually a little yellow today. It is. It's a little yellow with a little bit of ring of red. I know that you all don't care, but that's what's
My
happening
allergies
here.
are kind of driving me crazy.
Oh,
so
is that it?
That might be.
That might
Let's
be
see
it.
what this one looks
I'm
like.
going to do the same thing here. You want to lift up and back. And again, I'm going to place this first gently, and then we're going to go in and take a quick look. And I'm looking, and again, looking, cone of light is at 5 o'clock. And it is normal you want to visualize that I saw the umba, the manubrium, and then also that the tympanic membrane is pearly gray. Cone of light is at 5 o'clock in the right ear. You can see some earwax. Sometimes you can see earwax that's fully impacted and you hit kind of a wall of this dark brown. That is very common actually in patients coming in complaining of ear pain. And usually what we do, or inability to hear. And what happens is that we actually have to remove all of that. And so that is when that you would use an otoscope in practice, is looking in the ear to look for that. Again, I've utilized this. I'm going to put it away, hang this back up. That is appropriate behavior to hang this back up before I continue my exam. I'm going to go ahead and do some testing acuity. One of the things that I'm going to do is the whisper test. So I'm going to actually come behind the patient, and I'm going to have her gently cup and press her cup over her right ear, if you can cup over your right ear, and I'm going to stand about 18 inches behind her, and I'm going to whisper 1, 2, 3. She will then tell me what I'm saying. I'm standing behind the ear I'm testing, not the other one, but the ear I am testing.
4, 5, 6.
She is failing. Let's go to the other ear, and if you can gently cup that.
1, 2, 3.
Great. So the patient passed the whisper acuity test. The next test that we're going to do is it's called the Rhine.
One of the things that I do, if you can't do that, if you can't do the whispered You can take your fingers and you can do this, and if they can hear that, it's almost like a whisper test too, and it just sounds like a little grating. So if they can hear that, it's the same.
Awesome. I love that.
Yeah.
Okay. Perfect. Thank you for that.
If they're in the
Professor
bed,
Joel.
you can't necessarily always get behind them and test their hearing.
That
and
is
stuff,
true.
But if you
Yeah.
go like this, it's, yeah.
I never touch patients' hearing in women's health. We just don't.
Yeah.
Yeah.
It doesn't matter if you can hear.
Right. Yeah.
Right.
So we're going to do the Rhine test. The Rhine test is looking at bone conduction versus air conduction. Air conduction should always be greater than bone conduction. So what we do is we start right back on this little spot, right back behind the ear. There's a little bit of a mark on the back behind the ear. What is it called? I know it's called something. The mastoid process. There we go. There we go. I apologize. Welcome to crash course in health assessment. So we're going to go ahead and remember the tuning fork. We talked about this, and we're going to place the end of the tuning fork on the mastoid process. The patient is going to tell me when she stops feeling the bone conduction. She's going to lie to me so that you don't sit here for 10 minutes and listen to it, okay? So I'm just going to tap this. You want to make sure, again, that you're not touching the base, and we're going to place this on the mastoid process. She's going to tell me when she no longer feels the conduction of the bone.
I can't feel it.
Great. Then I'm going to bring it outside her ear about 4
hear it.
inches. She should be able to hear the air conduction of this. So again, air conduction should always be greater than bone conduction. Let me know when you stop hearing it.
I've stopped hearing it.
Great. During your competency, again, we don't expect you to go the full time. That way, you don't run out of your 10 minutes. We're going to go to the other side and do the same thing. So again, you want to tap this. You do not tap in between the bone conduction and the air conduction. You just tap between each side. So then you're going to place this again on the mastoid process. And this is bone conduction. She's going to let me know when she no longer hears it.
No.
And then we're going to go to air conduction. You're
Yep.
about 4 inches from the ear. You can hear this.
Mhm.
Awesome. Are you no longer hearing it?
No longer.
Awesome. Great. So bone conduction is less than air conduction, or air conduction is greater than bone conduction. However you would like to look at that, okay? Gives us an idea on what's going on with the patient for possible hearing loss. Now you're going to do the Weber test. I call this the Weber Rabbit, or Weber Wabbit, if you know the old cartoons with the guy with the...
Elmer Fudd.
Elmer Fudd. Thank you.
You're welcome.
Elmer Fudd. Thank you very
You're
much.
welcome.
That just went... Okay. If you take my labs, you're used to me. I'm sorry if you don't. Okay. So, again, you're going to take this tuning fork. I'm going to place the center, again, the base of this, all the way up to the center of her head. You don't want to put this on top of all of her hair. You want to actually get to the scalp. The reason is that I want to know if she's having equal bone conduction on both sides. Okay? So I'm going to do this again. If you want to lift your head up for me. Awesome. Thank you for giving me some space on top of your head. And I'm just going to press this here. Do you feel this equally on both sides?
Yes, I do.
Great. As you can see, the ears of the tuning fork, hence the rabbit, are facing forward, and we don't want them to be facing this way. You want them to face forward so that we know that we're getting equal bone conduction on both sides, okay? You want to make sure that you do that. That is a very important component of this exam. We are now done with the tuning fork. Yes, ma'am.